So it's a type of cancer that begins in the tissues that line the heart, the lungs, stomach, and occasionally other organs as well. Mesothelioma is usually linked to asbestos exposure, but actually only 10% of people who've had asbestos exposure will actually develop it. Asbestos was actually banned in the UK in 1999, but it was widely used in insulation before this, as well as in construction materials. So high-risk professions include things like mechanics, people who work with brakes and clutch linings, construction workers, dock and shipyard workers, plumbers and electricians. There can be a 30 to 40-year lag in developing mesothelioma after exposure, so cases are likely to rise in the next couple of decades before falling, certainly here in the UK and in Europe. But sadly, asbestos is still widely used in many countries globally, so it will be a serious problem for a long time to come. Very rarely, mesothelioma can occur after radiation exposure, including things like radiotherapy, but there may also be, in a small number of cases, a genetic component. Very occasionally, cases will be identified from routine scans without symptoms, but much more commonly, because mesothelioma can affect the lining of the lung, for example, we call it the pleural space, you can get a buildup of fluid, and that can cause breathlessness. And also, because the lining of the lung can be involved, you can get chest pain. Those are the commonest symptoms. The rarer types of mesothelioma that affect other tissues in the body can cause other symptoms, such as abdominal or scrotal swelling. And as the disease progresses, people can lose weight, they might feel fatigued, they lose their appetite, and mesothelioma can spread to other tissues and organs, but this is much less common than with other common cancers. So unfortunately, it is almost never curable. This is because most patients are diagnosed when the disease is too advanced. Surgery is an option for a small minority of patients, but it's a really big operation and with quite a high rate of complications and even mortality. So the British Thoracic Society doesn't recommend surgery outside of clinical trials, but research is still ongoing just to try and better understand the role of surgery in the disease. The prognosis of mesothelioma is, as a consequence, not very good. And about 50% of people who are diagnosed with mesothelioma live for about a year, and only 10%, unfortunately, live for at least 5 years. So treatments are designed to control the disease and improve symptoms, but not to cure it. And until recently, the only treatment that actually was shown to extend life was chemotherapy. And that can have significant side effects, unfortunately. Recently, a treatment called immunotherapy has been shown to be much more promising. And although it still doesn't cure people, it does appear to offer longer survival and with better quality of life for many patients. Radiotherapy can be used to reduce symptoms such as pain in some patients, but also effective management of any fluid buildup around the lung or within the abdomen may also maintain quality of life. It's really important that mesothelioma is treated as with what we call a multidisciplinary approach. That means that many different doctors, nurses, and therapists are involved in the care of these patients. And it's also important to involve specialists in symptom management, also known as palliative care.